Cord. It is September 8th, week 6. We'll be having laboratories starting week 8. And remember, get a call to me, get me information if you cannot make the laboratory so that we can find other ways for you to do the laboratory work. And you know, you paid for it. That's the fun part in my opinion. These lectures, they're all well and good. You could always Google it, and you know, and they're, I'll admit, like, no matter how animated I can try to make it, it's still not as good as when you guys are in the lab. That's why I'm hoping we're having a vote on it soon, that I'm hoping that we all go back to, you know, going back to on the ground. Because this course, the way I designed it on the ground, not this hybrid way, we have labs almost every other week. So, you know, I record the lectures, and when you're in class, you get to do stuff, you get to play. And how many times I even taught like some minor surgery stuff in this class because we had extra lab time. But, you know, for COVID and for safety reasons, we got to do it this way. So this week 6, week 8 will be the start of labs. Week 8 and 9 are the labs. And then week 10, of course, we'll have our final exam. Final exam is based on anything week 5, 6, 7, and week 6, 7, 8, 9, and that'll be the topics. Now, what did I do here wrong? Okay, so what's due today? Of course, please, if you haven't done so already, try to get it done by closing of business. I won't look at grades until later tonight because of this little emergency that I was talking to you about earlier. And again, my apologies for having to start at 10. Task 5, discussion 5, and lesson 5 are due today. And what are we doing today? We are doing the skeletal system. Now, a lot of it is going to be identification. Okay, so, you know, once you see a picture, once you see a diagram, you take it, look it up, and you don't even have to do it yourself. Why don't I just show you how easy it is to study for? You just look up any old quiz, hit images, and bingo, you have something like this. Do you think you could take that and practice that? And or take this and go A, B, C, D, E, F, G? Yeah. And a lot of this stuff, you don't even have to do it on paper. A lot of this stuff, free anatomy quiz, you can go online and do it, right? So which one is the sacrum? Oh, I don't know. Is it 6? Is it 7? And then, you know, what number 1 is, right? And practice, because that's what some of you may have gotten your, well, not some of you, I sent everybody their midterms, but the feedback that I got is like, oh, I don't believe I did so bad. And don't see it as bad or good. See it as, let's say I got an 80, which is a good solid score. I would be, as a student, worried about the 20% that I got wrong, not the 80. You know what I'm saying? Like always, I call it positive pessimism. A lot of people say, oh, Dr. Garais, you're always looking for, you know, the cloud. You're always looking for the bad thing that's coming ahead. Yes, because so I can prepare for it. Because, you know, and when I do poorly on an exam, or even if I do well on an exam, I always harp on the ones I got wrong, not to be, you know, Debbie Downer on myself. It's to remind myself is that's the thing that I'm deficient on, and that's the thing I work on. It's like in the gym. No one likes leg day. It's annoying, it's painful, right? And you know, when you're at the beach, no one looks at your legs and go, ooh, look at those quads, right? No one does that. Thank you, Nelson Hermy. My son's next to me doing some work. At least he appreciates my humor, right? No one looks at that, but exercising your legs, especially if you're using your quadriceps are the largest muscle mass in your body. So if you develop those, it's going to eat up a lot of glucose. It's going to eat up a lot of energy, and it's really good for fat burning. And that's why cardiovascular stuff is always all about the legs. So that's my little side note on muscular / exercise physiology. So we're doing chapter 6, which is bones. Now we look at bones. a lot of people just look at bones, especially laypersons. They look at it like they would look at a chair. You know, it's there for support. It's supposed to be strong, but but to us in the medical field, it's more important than that. It's not only support, also facilitates movement. Have you ever broken an arm or a leg or a finger or anything?
Yeah.
Try moving around. It's so painful. If ever you met me, you saw my right hand. One of my fingers are all bashed up. Well, actually, all my fingers were at one time bashed up. Humvee fell on it. And I remember that day. It was so hard just to move. And it was so painful. And I was hunched over and I was bent over. It also protects your internal organs. And we're going to talk about, the different anatomy of your rib cage, which is really important. And your heart and your lungs are crazy important for you to live. Therefore, whoever built us pretty smart. Another thing that is really interesting about bones is that it is hollow and there's things in it. And there's blood, there's fat, there's arteries, veins, and nerves. So when that breaks, we're going to have a problem with making blood cells, right? And that's called hematopoiesis. And we're also going to have a problem with our minerals and fat storage, because now these minerals we're going to get all spilled out into our blood and the rest of our body. And the fat also gets all spilled out. So you could see where when you have a broken bone, I'm not only considering your mobility, I'm considering a whole bunch of other things. And your red blood cell count is one of them, your minerals and the fat rolling around that could be a potential embolus or blockage somewhere in your cardiovascular system, especially if it's a large bone like your femur. Fat emboli is also a consideration, because that globule of fat can end up somewhere, lodge itself in an artery somewhere. And if it's in your heart, you could have a heart attack. If it's in your brain, you could have a stroke. So we get a little bit excited for several things. And doesn't this, when it's a list like this, doesn't this look like a beautiful all of the above question? Hint, hint. Doesn't this look like which of the following is true except, right? Like, for example, is it supports the body, facilitates movement, protects internal organs, or D, destroys blood cells? And it goes, that would be the exception. So you could easily figure out, and especially when you see a list like this, it screams all of the above questions. So, oh, look at this girly man. Just kidding. He should put way more plates than that. But at least it has this good form. It's good form here. All the way to your chest where it's supposed to be. Your squat should clear. Well, now I'm getting into sports physiology. Let's not go there. But you could see he's working his quadriceps, which is a very important muscle. Now, if anything happens to any of these bones, how well can he move any of those muscles and joints? Can't. And the people in your neighborhood, your orthopedist, this is a brace, and it even has this little built-in, this thing, there's this thing called the goniometer, which measures your range of motion, or your ROM. And there's these little, what do you call that? Numbers here that the orthopedist or the surgical specialist, because they usually, orthopedic medicine usually deals with things surgically. Because, you break your bone, you can't, I can't give you like aspirin and make it go away. I got to do something about it. Now, I told you that bone is hollow and has things in it. Well, yellow marrow, of course, has adipose tissue or fat. That makes sense because fat's yellow, or like a milky yellow color. And red marrow, which you could see here, is where hematopoiesis, or the production of red blood cells, which are really important. Makes some white blood cells and some platelets, but the main star of the show is red blood cell. Red marrow, red blood cell. Now, when we look at bones, they could be classified, like to make it orderly, there has several kinds of classifications. So you can have flat bones, which is your sternum here, right? This is your corpus, and this is your manubrium sterni right here, and this is your xiphoid process. If you took CPR, you'll remember that part. And it's flat. Another example of a flat bone is your skull. Because when you think about it, your skull is like, it's flat like a pancake, but it's kind of molded. So that's another example. Long bone, anything that's long. So you have your appendicular skeleton, which is your arms and your legs, also known as your appendages. And this is the largest, longest bone in your body, which is your femur. It takes a lot to break this bad boy. Like my last patient who broke, I think it was he fractured his femur. He was one of those bike riders in New York City, got hit by a UPS truck, and then and got hit pretty hard and thrown, and he broke that. I've been thrown. I can't even imagine how many broken bones I have. I think it's like 6 or 7. Because I was one of those kids. I was thrown from a car when I was younger, and I only partially fractured my clavicle here and a couple of bruised ribs. So you can only imagine what it takes to break this thing. Sesamoid bone, your patella or your kneecap, because it looks like a little seed, like a oid means resembling, and it looks like a sesame seed. And that's your patella or your kneecap. You could also have irregular bones, which are weird, and your vertebra or your backbone is one of them. And we're going to go over the different types and how you identify the different types. Another irregular bone is your pelvis here. Here's your ilium, and here's your ischium, right? And those are irregular as well. You also have short bones. And I want you to think of the short bones in your ankles. Whoops, this is your ankle, sorry. And in your wrists, okay? So, and they look like dice. So sometimes they call them cuboidal or short bones. And those are your carpals right here, and your wrist, and your tarsals right here in your ankles. So that could be a potential question. Don't you think I could point at something and go A, long bone, B, short bone, C, flat bone, B, D, irregular, E, sesamoid? I could easily do that. Right? So right now I'm giving you guys all the hints, but in the future, when you're in a boring lecture just like this one, start using your active listening powers. Ask yourself, are the objectives that I just read before the class, how would they match up to how he would ask the question? Now, Dr. Garais mentioned, great, I'm talking about myself in the third person, which is kind of weird, right? I mentioned that, this is a lot of pictures. Hint, hint. Can I just take this picture and go A, B, C, D, E? Sure. Now you have your epiphysis, proximal because it's closer to midline, and here's your distal, of course. And you will notice that on the ends, we have articular cartilage. Now, cartilage is made up of the same stuff or material that bone is, but it's much, much softer. And it's because it has less minerals in it. So the articular cartilage on the end, they're utilized as shock absorbers and also to decrease friction when the bone is moving around, because when you're younger, you got a lot of this. When you're older, my orthopedist and my rheumatologist can contest, this starts wearing away, especially at my knees, which is never a good thing. Of course, you have spongy bone, which is the bone that I said that was hollow. And then you have compact bone, which is in layers all on the outside. And we're going to be looking at this layering as a theme here in bone, because like I stated, the bone is very, very strong, especially this femur. It takes a lot. But then, as a rational human being, you probably thinking, how hard could it be because it's hollow? Well, it's just like this. A newspaper, if I take a couple of sheets of newspaper and I, loosely hit it over the top of your head, you'd look at me and go, what are you doing? What's wrong? But what happens if I took that same paper, rolled it up really tight, and then hit you with it? You wouldn't be reacting so kindly. I've been in martial arts more than half my life. And I had one teacher who he used to give this demonstration on how he would roll up a newspaper and break a cinder block with it. It was the creepiest thing you could look at, but then you could see it as a physiology of bone, how all these layers contribute to what? Its strength. It's also the same thing. Modern aircraft is no longer made out of metal. It's made out of carbon fiber composite, sandwiched after sandwich after sandwich of carbon fibers. Hint, hint, guess what human beings are made out of? Carbon, right? And layers. So we have compact bone, and then you have spongy bone. You also have this thing called your epiphyseal line. Now, when you're growing up, that's where you grow, in this epiphyseal line. When you get to a certain age, you stop growing. I think I stopped growing when I was like 11, right? Hey, quiet. I got stuff to do, right? I thought my son was laughing at my joke, but he's laughing at something stupid he just saw. Your epiphyseal line turns into an epiphyseal plate. And if you get a fracture here, especially when you're young, when your epiphyseal line, you're going to have a lot of growth problems. Okay. And when you get, and remember, your bones are made out of artery, veins, and nerves. Oh. Artery, veins, and nerves, right? And then you're going to feel that growth, and hence the growth spurts. Now, you also have the inner layer, or the endosteum. The periosteum, or the compact, right, is hard, but the inside is soft. And that's a theme in the human body, isn't it? You have a lot of hard things and protective things on the outside, and soft and spongy things on the inside. Of course, your epiphysis, epi means right on top of, meta means change, and that's where you'll find your epiphyseal line if you're an adolescent, an epiphyseal plate as an adult. Your diaphysis, which is the shaft, right? Dia, complete or thorough. And again, metaphysis and a distal epiphysis. You have nutrient arteries and veins, and of course, nerves. Yellow bone marrow. Yellow bone marrow, which is, of course, full of fat. So if this breaks, you're going to have a lot of fat. You're going to have a lot of blood everywhere. And that's the two things that we don't want. So what else? Oh, remember the layering that we talked about? Do you see these bone cells, or they're osteocytes? They're forming layers and concentric layers. So, and you could see it's like a sandwich. And by the way, that carbon fiber material that made out of racing cars, and it's the same material that's made out of modern day fighter jets. You see how it's like sandwiched between something hard, something semi-hard, something trabecular or spongy, and then it's like a sandwich. So that's how your bone maintains its light weight, its incredible strength, well, not incredible, I don't want to use a superlative, a significant amount of strength. Oh. And if ever you've heard that it has better tensile strength than steel, that is true. Because once I break steel, it's broken. It doesn't repair itself. So let's go over these cells that you'll see here. And where is my Microsoft Word? Let's talk about bone remodeling. This is the reason why, especially children, how they recover so fast. I used to do a lot of skateboarding and surfing, like California type sports. I don't know why. I grew up in New York and New Jersey. Why in heaven's name did I grow up with that kind of stuff? But I did. So there were a lot of broken bones, a lot of getting hurt. When I was young, I could take a really, really bad fall, get up, and nothing would bother me. 2 years ago, I fell out of my car and almost had to call an ambulance. And this is why. So bone remodeling is when the bone kind of repairs itself. So you have here the mature bone cell. That's your osteocyte. Now, the immature bone cell is called your osteoblast. So the immature cell can't do much. The osteocyte does a lot of things. So that's part of the cycle. Now, when the osteocyte gets damaged, or how do I get back to? When the osteocyte gets damaged, there's a bone that breaks it down and recycles it. Okay, that's what I want to do. Okay. So when the bone gets damaged or gets old, the osteoclasts go in, clash, and break them down. And then signal more osteoblasts to be created so I can get more osteocytes. Now, this is called remodeling. It's a constant cycle of breaking down, building back up, breaking down, building back up. And this is highly efficient when you're young. When you're old, the osteoclasts tend to win. They break down way more than you build up. But when you're young, it's highly efficient. And that's why you have instances in orthopedics where, I had a little girl. She was like 4 years old. And I forgot what happened, a door or something metal amputated the tip of her finger. Well, guess what? The bone in the tip of her finger grew back. Okay. And why? It's not because, she's a lizard, not a human being. She's young and her remodeling is quite efficient. So she's able to make osteoblasts really fast. And then it turns into the mature osteocyte, and all the damaged or old osteocytes get broken down by the osteoclasts. And this is called remodeling. Okay, now the bones that you're going to be learning are just basic. Like here's the humerus, here's the femur, here's the phalanges. But eventually, if you want to go to graduate school, every bone has different markings and connections and little holes in them. Articulations, heads, facets, condyles, projections, protuberance, processes. There's all these things. And they're going to have holes and depressions. Some of the depressions of the grooves are called sulcus, if it's singular, sulci, if it's plural. Meatus is opening, and it's typically it's opening into some sort of canal. Sinus, like the air-filled spaces in your bone in your skull. Okay, so if you have sinusitis, they get filled up with either pus or fluid, and that's why your head feels like a bowling ball when you get sinusitis, and then you have a hard time listening and hearing and talking. Now, here's your sinuses. They're spaces within the sandwich that we call your facial bone and your calvarium or your cranium right here. Okay. And you can have things like a crest or a depression or a little valley here, like a fossa. Tuberosities are like these little ridges that stick out. Again, another fossa, right? Which is another depression right here. So eventually all of those things have names. You're going to have to eventually learn that, but not for this class. That will be for if ever you take gross anatomy or human anatomy. That is a 1-year course of something like 40 weeks with 9 hours worth of lecture and another like 9 hours per week lecture or 8 hours per week lecture and 12 hours a week laboratory. That's how specific the human body can get. Knowing this course would be of advantage to you. Osteoblast, we already talked about them and what they do. There's a nice chart right here you could look at. Now, again, that theme of concentric circles all wrapped around really tight. Your bone has spaces in it. And those are called Haversian canals. It's the way the artery, vein, and nerve can innervate all throughout the bone. And that's why it hurts when you break a bone. So in the compact bone, you have these things called osteons. And they're like little groups of I don't know, the way I look at it is like, you know how you can easily break a twig, but if I wrap a whole bunch of twigs together, it becomes a very strong bundle. So the osteon is like a bundle of concentric circles, right? With a Haversian canal in the middle. And inside the Haversian canal is an artery colored red, vein colored blue, and nerve colored yellow, all throughout. And it's the reason why the bone is a living, breathing thing. And it needs all of this. And of course, here you have your trabeculae, which is trabeculations or branching out. Here's your spongy bone. And this is how I definitely know I'm in the compact bone, because there's little to no spaces with these. And these layers are called lamellae for plural. So, and each one of these big circles is an osteon, or a functional unit of bone. Okay. And you could see here, like in Paget's disease, if you have a bone remodeling problem, it'll remodel the bone the wrong way and build it up the wrong way. And that's all that pathology really is. You take normal and make it abnormal. Now, I mentioned cartilage. Cartilage and bone are, all intents and purposes, the same thing. But the difference is that the cartilage has much less mineral matrix, or much less minerals. And it makes sense, because wherever we need cartilage, we need it to be softer than bone. And we've already seen one example of it, which is your epiphyseal cartilage at the ends of your long bones, so that it will offset any friction, and will also be a nice shock absorber. Another area that we have cartilage is, of course, your intervertebral disc. Instead of me talking about it, let me show you it. You see in between your spine. Oops, why is it doing that? In your vertebrae, one of your irregular bones, in between them, there's these shock absorbers. And those are made out of, what do you call that? Cartilage. And of course, you also have one as well in your pelvic bone. And you also have tons of cartilage in your rib cage. And it makes sense. Do you need, now, how's this? Let me pose this question to you. Why would you need cartilage in your chest? Give you a second to think about that. Why would you need cartilage in your chest? No? Well, when you breathe right now for me, like deep breath. Do you notice your rib cage is moving up and out? Now, if that was all bone, that would be a problem. It wouldn't be able to move up and out. And a less obvious location of cartilage in your pelvis, especially for the female anatomy, is also sometimes it bends and sometimes even disconnects, especially if the baby's really big. Now, we're not going to talk about like osteogenesis or how to make bone, but we kind of already know how to make bone when we talk about remodeling. Real quick, this is not a pathology class, but eventually, these are some nice to know, and you'll definitely need this for CPR, and not CPR, But I highly recommend when you take CPR, take the CPR with first aid slash basic life support. It's way more expensive. It's like $95, but that's the better deal. And it's there's also first aid in there as well. And nowadays, I know for a fact that Inova and Centara demand that their administrative personnel have BLS CPR first aid certification. They want because how many times my wife works as an administrator, how many times did she need a clinical eye and clinical skill sets? When she was an office manager, she used to come back to me and goes, I did CPR today. And I'm like, what? She goes, oh, and I'm like, you're supposed to be up front doing the billing and calling insurance companies. What are you doing? She goes, well, everyone was busy. And he goes, the guy passed out. He was irresponsive. I called 911. And I'm like, okay. And let me tell you, this is a woman who used to, when I was in medical school, when she used to bring me my clothes and my lunches in medical school, and in my internship, she used to cry because she can't stand blood or suffering. Now it's old hat to her. So for those of you on watching this video, if you're a squeamish person or you think you can't handle something, just try it. You'll be amazed what you get used to. It's amazing what you get used to. Would you believe that I used to be afraid of needles? Actually, I'm still afraid of needles if I'm the one getting poked. But now, administering needles or doing minor surgery, I don't have a problem with it. But when I was younger, it was kind of gross. So you can have a closed or an open fraction. Open fractures aren't good because you can see it's now opening the sterile environment to the outside world. Transverse, of course, means a fracture that goes straight across. Spiral is a fracture that kind of twists, because NFL season is upon us. When the foot plants right into that turf, this thing turns and then fractures. Comminuted, also very common with bullet wounds. Comminuted, there are a lot of fragments. This is no bueno. And regarding bullets, it is not the bullet itself that is the fearful thing, which laypersons usually think of. It is that shockwave the bullet brings. And nowadays, bullets, they hit this, and when they hit even soft tissue, the bullet spins like end over end, and that's called cavitation. It causes even more damage. I just read an NPR article a month or two ago. It costs $24,000 in therapy. That's just physical therapy if you get shot. So you can only imagine how much more, like if it was surgery or you have trauma, because unfortunately, from experience, getting shot at is a highly unnatural situation, and I could easily see how a lot of people get messed up by it. Impacted, usually when the force is upward, like if my patient takes a fall from height. Green stick. Now, green stick, usually a child under the age of 5 years old will get a partial fracture. And they call it green stick because, when you break a sapling or a new twig, it only breaks on one side and then it bends on the other. An oblique is just like a transverse, but it's diagonal, like that. And again, in order to get this kind of fracture on your femur, it has to have a considerable amount of force. Okay. Bone repair, we kind of talked about, and it's the same thing as remodeling. Same idea, same concept. Nutrition. Oh, what else is also important? Well, bone mineralization is also dependent upon vitamin D. The thing is, you can ingest vitamin D through food and supplements, but a really neat way that your body does it is it processes UV radiation in your skin, and then the vitamin D then gets stored and then transformed into the liver. So vitamin D synthesis, really good to have in your diet. That's why the patient needs to get out every once in a while. My wife just did a report, a paper or something. I don't know why she was doing it on the recent studies on having mandatory walking groups in facilities, especially elder care facilities. And it also has the beneficial side effect of getting sunlight and vitamin D. And I believe I was telling the class as well that my kids were diagnosed last year with vitamin D deficiency, and it makes sense because a year or two ago, we were all deep in the pandemic. The kids weren't going to school, so all day, every day, they'd be here in the basement with me, just on screens, right? So I'm sure if I got a test, I'd probably be vitamin D deficient as well, because the majority part of my day, even when I'm on campus, is in some sort of lab or in some sort of room somewhere. Vitamin K is also big for bone mineralization. Another big thing about vitamin K is also for blood clotting and bleeding. Now, doesn't that make sense? Whoever designed us put that system in the bone where hematopoiesis, or the production of red blood cells, are. Pretty smart. And here are some of the other vitamins and its role. But vitamin K, vitamin D, calcium, magnesium and fluoride, very, very important. Calcium carbonate and magnesium sulfate, they're very, very big things that we look at regarding nutrient and bone health. And of course, aging, what happens? You have decreasing bone mass with age, and especially women. Why women? Why women more than men? Because women have babies, and the bone resorption of turning calcium in the bones into milk is very, very important in female physiology. And that's why we pay close attention to both male and female, of course, but I pay very close attention to my female patients greater than 40 years of age. And I believe it's around 60 when we start doing DEXA scans. And it makes sense right here. I don't order DEXA scan until like age 60, 65, even if they're asymptomatic. I'd like to see where their bone density is. Things to think about. Now let's look at some hormones that deal with the skeletal system. And remember, the skeletal system has nervous system in it. So it has arteries and veins in it. So it makes common sense that there has to be the chemical communicator portion of the show in bone. So of course, growth hormone. By the way, growth hormone, or also known as GH, is very active in adolescence and in puberty, of course. Not so much in the adult physiology. Thyroxine, or your thyroid hormones. They stimulate bone growth, and because your thyroid hormones are part and parcel of your metabolism. And remember, what is the function of metabolism? It's to break down things. Why am I breaking down things? So I can grow. And thyroxine is one of them. Sex hormones, of course, puberty, that's related to growth hormone. Calcitriol, of course, stimulates the absorption of calcium and phosphates. Phosphates is also another set of minerals that give the bone its strength. Parathyroid, they stimulate osteoclast. So if calcitriol stimulates absorption of calcium, parathyroid would stimulate what? The breakdown or bone resorption, right? And that's where I also get calcium. And parathyroid hormone is very, very active, especially for your female patient who needs it for nursing. And calcitonin does the exact opposite. Inhibits osteoclast and stimulates calcium. So think calcitonin, calcitriol, think increased calcium. Parathyroid, think decreased calcium. Hint, hint, doesn't that look like a beautiful, is it increase, decrease, both, or neither question, which I've plagued the thousands of students before. And here's a lovely chart and also shows how your kidneys are also involved in calcium homeostasis. So it's not only do you eat right, but do you also process all of these things correctly? Okay. Well, that's a nice chart. And so is the one previous, in the previous page. All right. We are done with chapter 6. Let us now go to chapter 7 and the divisions of the skeleton. And this is a nice picture. Look through it. I'm not going to go over each and every one now, but you got to know it. So phalanges, it's your fingers. But if I say lower extremity, it's your toes. So phalanges, upper extremity, it's your fingers. Phalanges, lower extremities, it's your toes. Tarsals, ankle. Carpals, wrist. Tib fib, the tibia is the stronger, bigger one in the front. Femur, we already went over. The pelvic bones, there's 2 of them. Ilium, and this round thing here, ischium. We're going to talk about the different vertebral columns. We're also going to talk about the different ribs in a moment. All this stuff in green is your appendicular skeletal system, which includes your shoulder girdle and your pelvic girdle. Now, you know what a girdle does. It wraps around things. So, of course, these set of bones and muscles wraps around your shoulder, hence the term shoulder girdle. And these bones and also the eventual set of muscles we're going to talk about wrap around your hip, also known as your pelvic girdle. Your arms, fingers, legs, and toes, all of them are part of your appendicular skeletal system. Now, your axial skeletal system is, of course, your skull, your rib cage, and your spinal cord. Doesn't that look like a beautiful all of the above question? Here's your calvarium, also known as your brain case, also known as your cranium, because it houses the brain. Facial bones here, common sense. Now, I need for you guys to know the basic bones here. I don't need for you to know all the holes or foramen. That's for future training, because then we have to talk about the innervations of the muscles and the nerves, and that's for more advanced classes. But what do you need to know if I show you this picture? This big pink structure here, frontal bone. This right here, your cheek, zygomatic. This orange or tangerine color, that's your maxilla. And your jaw, mandible. Okay? And of course, your eye sockets are called your orbits or orbital. Orbital fossa, sometimes they call it. Okay? So that's the worst I'll do to you regarding the anterior skull. Lateral view of the skull. What do you need to know? You need to know these sutures. And what are suture lines? That's when 2 bones eventually fuse. Remember the soft spots called your fontanelles when you were a baby? Or maybe you have a baby in your house? Those are the soft spots. And eventually they grow together. The soft spots disappear because the bones get larger and grow together. And one that forms right here between your frontal bone and your parietal bone up here, that's called your coronal suture. Where all of these sutures meet in the side of your head is called your pterion. Okay. This is your sphenoid, and this right here is what do I? This is your temporal right here, sphenoid here, frontal here, parietal here, and the one in the very, very back is occipital. And again, then of course you need to know your nasal bone is of course part of your nose, maxilla, and mandible. And here's where your external acoustic meatus, that will lead down into your internal auditory canal that's going to your eardrum. Okay, so that's the worst I could ask you on this lateral view of the skull. Internal view, know that these are called fossa. There's an anterior, there's a middle, and a posterior, and that's your calvarium or your cranium, and it houses your, of course, brain. Your brain sits in here, there's fluid all around it, so it kind of floats. So it's another protective function for your brain. The only real structure that I want you to know here on the inferior surface of your skull is this big hole here for your spinal cord and spinal column, and that's called your foramen magnum. Foramen means hole, magnum means very large hole. Here's the back portion. You have your parietal bone. There's two of them. I always say I have a pair of parietal bones, and the suture that separates the two sides, left and right, that's called your sagittal suture. And you have a suture here that's called your lambdoid, and this is your occipital bone. And there's a ridge right behind there, and that's clinically important for people who are on steroids. That ridge tends to grow when you abuse steroids or anabolic steroids. Also known as PED, performance enhancement drugs. Never a good thing. Okay, let's jump to that's enough of the skull. Let's look at the vertebral column. Only one picture you need to know. Now, when we look at the vertebral column, when we look at it straight, like front to back, anteriorly, it's straight. But when you look at a transverse or side view, there are natural curvatures to the spine here. So you have 7 cervical or 7 ones in your neck, and you have your C1 and C2. Your C1 is your atlas, and that gives you the ability of nodding your head yes. C2 or cervical 2 is your axis. That gives you the ability to nod your head or turn your head no. So if my patient can't turn their head, not my head, but their head to the left or right, then I'm going to consider C2 fracture. If my patient can't move their head up and down, like in yes, then it's a C1 atlas fracture, or I'm thinking of that. Then we confirm upon CT or X-ray or whatever. Now, you have 12 ribs, therefore you should have 12 thoracic vertebrae. Now, what makes them special is they have these little facets on the side that connect to the ribs, and that's how you can tell them apart. You have 5 lumbar, and what makes those important, the body or these big chunks here, this 1, 2, 3, 4, 5, they're thicker than the rest of them. And it makes sense. It's supporting a lot of weight up here. And then at the very end, you have a fused sacrum. This is your sacral bones. They're all fused. They're all glued together. And then it ends here in your coccyx, which is the very end of your tailbone. Okay. Now let's look at some specifics. Now, what's important about this? What's important is that it houses and protects your spinal cord. And you see these things that are coming out of your spinal cord? Those are spinal nerves. So if any of it gets cut or impinged, we're going to have a problem. Okay. And of course, we talked about the cartilage in here, and it has this soft jelly center called your nucleus pulposus, right? And that is your intervertebral disc, and all of that light grayish blue area is made out of not bone, but cartilage. See there, C1 atlas, C2 axis. And what makes it special about the thoracic is it has facets to connect to the ribs. And we have 12 ribs, therefore 12 thoracic vertebrae. Your lumbar, what makes them so important is if you look at the body, it's very, very thick. This is the thick, thick body. Your sacral, are fused bones. There are nerves that go in and out of all this foramen, which are your sacral nerves, which have a lot to do with urination, erectile function, sexual function, and also walking. So you don't want to fracture that or any of those problems. And at the very, very end, that's your tailbone, also known as your coccyx. Now, the intervertebral disc can herniate, hence the term herniated disc or slip disc. So if the nucleus pulposus starts deteriorating, or well, actually the external walls of the intervertebral disc starts deteriorating or gets pressed out, you could see how it can easily press on a spinal nerve and either cause paralysis or pain or both. Okay? And that's never a good thing. Let's now look at your thoracic cage. We already went over the manubrium sterni. This is the body or corpus, and at the very end is your xiphoid process. And let's look at this. There are 12 thoracic vertebrae and 12 ribs. Are they going to show the ribs? Better picture? No, they are not. Let's show better picture. I don't like that one. Look at this one. Okay, this one's nice. So if I'm looking at my rib cage, you could see that all of this is cartilage. That's your costal cartilage. And that's important so my chest can expand when I breathe. Now, if you look at what they call the true ribs, the true ribs are ribs that are directly connected to your sternum. So ribs 1, 2, 3, 4, 5, 6, and 7. You could see how they're all connected. Now, 8, 9, and 10 are called false ribs because they connect into the cartilage of rib number 7. And 11 and 12 do not connect, and those are called floating ribs, and the function of the floating ribs is to protect your kidneys in the back. Okay? So I could show you this picture, and I could ask you, which one are true ribs? 1, 2, 3, 4, 5, 6, 7. Which ones are false? 8, 9, 10. And which ones are floating? 11 and 12. 11 and 12, the floating ribs do not connect into the sternum whatsoever. And they're floating because they need to protect my kidneys, or our kidneys, or your patient's kidneys, whoever's kidneys. Appendicular skeleton system. Let's go over now. You can look at this chapter, joints. Appendicular skeleton we kind of went over already, but you know what? I don't like this. I like this better. What are the 3 types of joints? No, that's not it. Are they not going to show it? Nah, they're not going to show it. Structural classification, maybe. Okay, this is kind of good. And this might be better. Let's look at this. So I don't, Oh, they're gonna make me do work. Okay, fine. Let's do work. Let me make my own chart. And then, so there are three types of joints. And what's a joint? A joint is the space in between two bones. Now, you have a fibrous joint that doesn't move whatsoever. Cartilaginous, they kind of move because it's cartilage. So it's in the middle. And then synovial, which is fully movable. So let's make a little chart. Insert, let's make a table. Let's look at the types of joints. So right now we talked about fibrous, cartilaginous, and synovial. Fibrous doesn't move at all. So the joint space shouldn't move. An example are sutures in your skull. Now, cartilaginous, some movement. And the example is, your rib cage, which specifically is your costal cartilage. Another example would be your vertebrae, specifically your intervertebral discs. And synovial, full range of motion, full ROM. And there's a whole bunch of examples. Anything in your appendicular skeletal system. So your appendicular, your fingers, your wrist, your elbow, your shoulder, your knees, your ankles, all of that are synovial. Now, what's so special? Where is the... Let me add one more. So it rows below. So when we're looking at this, there's also these terms that you'll see on exams in synarthrosis, amphiarthrosis, and diarthrosis. So let's look at our chart. Synarthrosis. Syn means the same. That means it shouldn't move. Amphi, right? Like amphibious, it's neither water nor land. It's a little bit of both. And diarthrosis. Dia means complete or thorough, complete, full range of motion, complete movement. Now, the thing about synovial joints is, we know fibrous, it won't move. Amphiarthrosis, also known as cartilaginous, won't move. It moves just slightly, right? But what does a synovial joint look like? Where are you? Pubic symphysis. No, I want synovial. Okay, here you go. Here's a typical synovial joint. We already know that on the epiphyseal, the epiphysis, there's going to be some cartilage, and that's your articular cartilage. You're going to also have some fibrous membrane to keep everything stable. And then you're going to have a joint that contains fluid. Any infection of that in fluid, then you get an arthritis. And there are several types of arthritis. And that's where we go to the Department of Rheumatology right? To investigate that. So think synovial fluid, synovial joint, fully articulated cartilage. That means it's diarthrotic. Okay. And here's an example, a little bit more complex example of your knee joint, which is a diarthrotic synovial joint. Types of body movements, you should already know them from anatomy and physiology. So I'm not going to go, I mean, from medical terminology. So I'm not going to go over those. And I think, let me check, that should close everything for today. So let's look at, did we talk about the structure of the skeletal system? Yes. Function of bones. Yes. Support and movement. And did we talk about joints? Yes, we did. We have a whole bunch of pictures, so we're good. What's due next week? Concept map for these items and the stuff that we talked about today. Let's look, see if I can give you a hint on this week's discussion. Again, use 2021 data. 3D printing is big. And if you can 3D print a gun, I think you can 3D print prosthetics. And there are these beautiful people around the world, and not just one, there's dozens. People who, some engineers, some hobbyists, they 3D print prosthetics for people because, you know, especially for children, they grow really fast. So having this kind of technology. So talk about the effects and what are we doing in 2021 for orthopedics and for bracing, and is this stuff that's made out just so that it's new and innovative, right? Is it worth, right? So find one or two specific advances, make sure it's from 2021, or heck, I'll even give you 2020, late 2020, but get something that's new. And then of course, answer at least one of your fellow classmates, but again, don't just answer, hey, I totally agree with you. Have evidence to back them up as well. And lesson 6, let's look at the case. Part 1, questions 1 and 2. Part 2, questions 1 through 6. And part 3, questions 1 through 4. You know what? Parts 1 and 2 only. More than enough questions. If you can figure out parts 1 and 2, I think you should be good. Parts 1 and 2 only. So parts 1 and 2, questions 1 and 2. And parts 2, questions 1 through 6. That's it. All right, it's at this point of the show that I stop recording and ask for any questions.